Do you work with the doctors as well? So you go and say, look, this is the plan I've put forward for the person, so the doctor's in the loop as to.
Most definitely, I think that's a really large part of our process, and we learn in our training that we call close the loop. So we always go back to the referrer, whether that's the nurse or the GP, and let them know what what the plan is for the patient.
Mm-hmm.
The patient always leaves with a plan, something to help move them out of that sort of stuck place that they might be currently in.
Sure.
We also write in the patient management system, so we write in the GP notes on the same system as GPs.
Oh, good. So it's anybody that needs to see it can see.
Yeah.
And how, in general, would you see a hip once a week, once a month? I suppose it's dependent on, but what would you start with?
So it might be, you might be struggling with a new diagnosis. For example, we use diabetes a lot, but just say you've been given a diagnosis of diabetes and you're really struggling with acceptance around that. You might come and see the hip for a couple of sessions.
Mm-hmm.
Then you might be referred to the health coach who'll help you understand diet and movement, and Loretta can talk some more about that, about the health coach role.
And is there a service available out of hours related to hips? Like if I was seeing somebody, for instance, and you always get a good rapport with who you're working with, and sometimes it's a trust thing as well. Is there any way of communicating out of hours, or would that be like a helpline or something like that?
Yeah, we normally refer patients to the 1737 in those instances. Most hips only work normal GP hours.
Of course.
There are some practices that have later hours, so you can be seen sort of in the evening, but they're not as common.
Okay. And children, do you see children?
We're generalists, so we see all ages, all ethnicities, we see everybody.
For everything.
Everything. Yeah, so we're generalists. So I guess one of the key aspects to this, because it's primary care behavioural health model, and we use a modality called focused acceptance and commitment therapy, and what that's doing is really connecting the patient with their values and what's important to them moving forward, and sort of pulling that all together for the best outcome health-wise for them.